Welcome to The Blend, a podcast brought to you by the Journal of the Dermatology Nurse Practitioners and Physician Assistants. In the fourth and final installment of this four-part episode, Dr. Sonal Choudhary, a dermatopathologist, dermatologist, and director of the Integrative Dermatology and Skincare Clinic at the University of Pittsburgh Medical Center, and Jazmyn Phillips, a Dermatology Physician Assistant at the University of Pittsburgh Medical Center, review some of the nutritional supplements that have shown to be helpful for people with hidradenitis suppurativa, including vitamin D and zinc.
This brings us to the supplement section.
Yes, it does. And the first supplement that I definitely want to touch on that's really important is vitamin D. Vitamin D is so very important on its use for HS. So, I always like to bring up, there was this cross-sectional study that kind of looked at vitamin D levels in 110 HS patients and 110 matched controls. And they did find that all of the HS patients were vitamin D deficient with a mean vitamin D level of 8.4, which it really depends on your lab, but typically labs will flag you as being vitamin D deficient if it's under 30. So this was significant. They're very low on vitamin D levels. And, that study did recommend that we should be supplementing people with vitamin D who have HS and definitely checking their vitamin D levels to see if it's something that we should. And also in a 2019 systemic review, it did say that low serum vitamin D levels was associated with an increased lesion count in HS. So if we can, supplement someone with vitamin D and their amount of lesions of their HS decreases, that is a win-win. And vitamin D is also good for bone health, which Dr. Choudhary was mentioning earlier. It's good for just your overall health and well-being. So it's a really good one and a really easy one. Either have patients start over the counter or easily get them a prescription, especially if they are this vitamin D deficient. So I always like to start with that one when talking about supplements.
I want to commend you on mentioning that study, Jazmyn, the 110 HS patients with 110 matched controls. I can see some of the listeners go, well, everybody's vitamin D deficient. So how do you know it's not just them being vitamin D deficient? Well, it's a controlled study, right? So you can see that people who were not having HS, and the HS patients were actually deficient. As you already know, that in our clinic, when we do the first set of blood work for our patients, whether it's for maybe starting a biologic or any kind of immunosuppression. Sometimes even when I am starting a patient on therapy of any kind, I try to check their vitamin D levels. And my reasoning for that is that so many disease states have an association with skin disease states with vitamin D levels being low. And if you have very low vitamin D levels, you don't have an important cellular vitamin that works as, say, a coenzyme to complete cellular processes. So in order for your skin to heal and not have inflammation, you need optimal vitamin D levels. And yes, we all often run low. I try not to supplement vitamin D until I have checked the levels, because you can have a toxicity with excess. It's stored, in our body in excess. So always check it. We do a 2-3 month, replacement, and then we can tweak the dose after rechecking it. So that's a little spiel on vitamin D that I want to give. Also, some of these HS patients may get prednisone here and there, systemic steroids because of flares, maybe PCP, maybe even dermatologists might use it. And we all know that systemic steroids can really deplete your bone really, really fast. So that vitamin D is a very important piece of the puzzle here for HS patients. And yes, vitamin D3 plus K2 has much better absorption. So that's the one I tell my patients to go for. And another thing that our skin really needs for good healing is zinc. Zinc is equally important in HS, and the North American Clinical Management Guidelines for HS, actually, they published, and not just United States, but also in Canada, the same guideline foundation exists, and they recommended zinc for patients with early stage 1 or 2. So that's mild to moderate disease state, because it's as a modular of innate immunity, it has great benefits in HS patients. They treated these 66 patients in that with a combination of anti-inflammatory, as they call it, oral zinc gluconate, 90 milligrams per day. And they combined it with topical triclosan, 2% twice daily. They had significant improvement in the quality of life index that they measured and the HS score. So there were other things that they measured in it as well, and they all had improvement in that, but a simple zinc replacement showed great improvement. So that's my spiel on zinc also. Next one I think we have is maybe vitamin B12, right?
Yeah, vitamin B12 is, really important to look at, especially because there can be this malabsorption component with vitamin B12, which, as we talked about, there is kind of this gut health association with HS. So we definitely always like to check B12 levels in that big panel of labs that Dr. Choudhary was mentioning. We also sometimes will talk to patients about turmeric supplementation, especially if they bring it up to us first. Typically, studies that look at turmeric are actually looking more at the active component called curcumin, and there has been found to be some anti-inflammatory property to that. The studies are, not really specific for HS, but something like turmeric, it doesn't hurt to try it as well, especially if you're a patient who is willing to try supplementing with different anti-inflammatory known supplements. And so that's sometimes another one that we look at as well. Any other supplements that you can think of, Dr. Choudhary, for HS that you mentioned?
I don't think so. I think that's a pretty well-rounded discussion about existing supplements that have data on them. But what I do want to mention is that talking integrative, you cannot not talk about stress, sleep, and trauma in these patients. Um, we have been recently sort of working on an idea of like, is stress, definitely stress follows when you have a major skin disease, but does stress actually precede the development of a disease state such as HS, or is it a part of the pathogenesis? So a case-controlled study where they had 71 HS patients and actually more than triple controls, 213 controls, they were provided with these questionnaires, including about their traumatic experience checklist. There's a childhood score called ACEs that can be measured as well. And they found that in this study that the childhood emotional traumas that were directly associated with HS, there was a significant association. And there was some kind of mistreatment that was noticed in these patients' childhood that was associated with development of HS later in their life. So this idea of like maybe early intervention especially in children where there is traumatic experiences, history of abuse, childhood trauma, can lower, if nothing else, lower their risk of development of not just HS, but even other inflammatory autoimmune diseases down the road. And some of the tools that are available out there, whether it's psychotherapy, there's, so many techniques available depending on what fits that particular patient, but can go through their PCP, can go through even their dermatologist. But trauma-focused therapies by doing cognitive processing therapy, prolonged exposure therapy, desensitization and restructuring therapy, name it. Like there's a long list, including things like art therapy and music therapy, have been studied in managing childhood trauma or past trauma, for that matter, which can have such a big role in preventing some of these disease states, making an effect on that complex pathophysiology already.
Yes, I agree. And as a dermatology PA, it's just so exciting to see all of these different types of therapies, studies coming out looking at this. It's just so important that we don't ignore the stress trauma factor and how that can cause and kind of indirectly and directly cause this sort of wide scale inflammation on the body through that stress. So I think that's super important. And I'm so happy that you mentioned it, Dr. Choudhary, for the listeners today.
We hope you enjoyed part 4 of our 4-part episode on integrative approaches to treating HS. Thank you for listening to The Blend. We'll see you back next time.